So what if I told you that the plain water you've been chugging every single day might not be giving your body what it actually needs after age 60? I know, it sounds a bit crazy, right? I mean, your doctor's been telling you to drink more water your entire life, but here's the surprising truth. Once you hit 60, drinking just plain water alone can actually leave your blood vessels starved. It can leave your circulation sluggish and your energy completely depleted. So, if plain water isn't enough, what is? Well, let me ask you directly. What is the biggest health challenge you're facing right now at this stage of life? Is it your energy levels, your circulation, or maybe those joints are acting up? Drop your answer down in the comments, because today we're going to explore how swapping out plain water for specific, science-backed bioactive compounds can fundamentally change how you age. Seriously, this is a real game changer.
Let's look at this number, 43%. A landmark study published out of the University of Colorado found that adults over 60 who optimized their hydration with specific bioactive compounds saw a massive 43% improvement in endothelial function, and that's just the lining of your blood vessels. Now, 43% is not some tiny rounding error. That is literally the difference between a 65-year-old who feels 80 and a 65-year-old who feels 50. So we're going to count down the top 5 drinks to add to your routine, going from good to absolutely extraordinary.
All right, kicking things off at number 5, coconut water, the potassium powerhouse. A University of the West Indies study found that swapping out just 1 glass of plain water a day dropped systolic blood pressure in seniors by an incredible 11 points.
To understand why, think of sodium and potassium in your body like 2 kids on a seesaw, right? When one goes up, the other needs to go down to keep your blood pressure perfectly balanced. But as our kidneys age past 65, well, that seesaw gets kind of sticky. It really struggles to manage that balance efficiently. That's where coconut water comes in. It is packed with bioavailable potassium, actually way more than a banana, and it greases that seesaw, helping your aging digestive system absorb and use it perfectly.
So what's actually happening inside our aging blood vessels? Well, it all comes down to oxidative stress. Put simply, this is like rust forming inside your arteries. And after age 70, your body's natural antioxidant defenses naturally drop by roughly 30%. Yep, 30%. But coconut water contains these powerful plant compounds called cytokinins, and they step right in to actively fight this arterial rust, essentially stepping up to substitute for your body's declining natural defenses. So, to get these benefits, here's your exact daily protocol. You're going to want to drink 8 ounces of raw, unsweetened coconut water in the morning, ideally right before breakfast. And please, skip the flavored varieties, they are just loaded with sugar. Now here's an amazing synergy tip for you. Pair it with a small handful of pumpkin seeds. The magnesium in those seeds works perfectly alongside the potassium in the coconut water to support healthy muscle contraction in your heart wall. Remember, your heart is a muscle, and after 60, it needs absolutely every advantage it can get.
Moving on to number 4, Tart Cherry Water, the inflammation extinguisher. Now, if you deal with joint pain, you're going to want to listen to this. Studies show just 2 weeks of daily use can reduce inflammatory markers by a staggering 25%.
You see, this joint and vascular pain happens because of something called inflammaging. It's this slow, chronic burn of low-grade inflammation driven by immune cells called macrophages that just get dysregulated as we get older. When your blood vessel walls get inflamed, they stiffen and narrow, which forces your heart to work so much harder. But Tart Cherry Water directly targets this inflammaging. Why? Because it contains massive concentrations of natural melatonin packed together with deep red pigments called anthocyanins. Together, they act like a literal fire extinguisher for systemic inflammation.
To really grasp the real-world impact of this, let's look at Margaret, a 71-year-old patient. She was just so frustrated. She was sleeping barely 4 hours a night, her knees ached so badly she had to stop walking her dog, and her blood pressure just kept creeping up. But after just 6 weeks of adding Tart Cherry Water to her evening routine, she said, "I'm sleeping 6.5 hours, walking my dog again, and my blood pressure is normal." Just one simple hydration change completely extinguished her joint pain and massively improved her blood flow. How amazing is that?
So to build your own anti-inflammation routine, here's what you do. Stir 2 tablespoons of unsweetened tart cherry concentrate into 8 ounces of water and drink it right around 7 p.m. And check out this surprising synergy tip. Add a tiny pinch of black pepper. I know it sounds weird, but black pepper contains piperine, which has been shown to enhance the absorption of those powerful anthocyanins by up to 20%. That one tiny addition makes the drink measurably more effective.
Okay, coming in at number 3, green tea, the vascular master key. And look, this isn't just about having a cup of room temperature tea.
Regular, proper consumption is linked to a massive 32% lower incidence of cognitive decline in adults over 65. The secret behind this is a compound called ECGC. I know, it sounds like a totally made-up word, but it literally acts as a master key for your blood vessels. Your blood vessel walls have these tiny receptors, kind of like locks. Well, ECGC fits those locks perfectly and signals the vessels to relax and widen, a process known as vasodilation. It actually partially reverses arterial stiffening by reducing the biological caramelization that happens inside your artery walls as you age.
But listen closely, because the specific preparation method matters enormously if you want these benefits. Step 1. Brew your green tea at 175 degrees Fahrenheit. Please, whatever you do, do not boil it. Boiling water destroys up to 40% of the EGCG. Step 2. Let it steep for exactly 3 minutes. And Step 3. Let it cool slightly and drink it between 10 a.m. and 11 a.m. Why then? Well, this late morning window aligns perfectly with your body's optimal cortisol rhythms for absolute peak vascular absorption.
And I've got a massive synergy tip for you on this one. Add a squeeze of fresh lemon juice. Doing this increases ECGC bioavailability by up to 13 times. Fascinating research out of Purdue University actually proves that the vitamin C in lemon juice stabilizes the ECGC in your digestive tract. This ensures it doesn't break down before your aging body can thoroughly absorb it. It's a total game changer.
All right, we are officially in the top 2. Number 2 is hibiscus water, the natural ACE inhibitor. Clinical trials show drinking this stuff daily can reduce systolic blood pressure by an average of 13 points in just 6 weeks. 13 points!
So, what does this clinical data actually mean for real people? Well, meet Robert. He's 74, was on 2 blood pressure medications, feeling dizzy every single morning, completely exhausted by the afternoon, and frankly, terrified his quality of life was just slipping away. After 10 weeks of adding hibiscus water to his daily routine, his numbers improved so much that his cardiologist actually reduced one of his medications. His dizziness resolved completely, and he told his doctor, "I feel like I got 5 years back." No way, right? But it's true.
So, the crucial point here is getting the preparation right. You want to steep 2 to 3 tablespoons of dried hibiscus, you'll often see it labeled as Jamaica in Latin grocery stores, in 8 ounces of hot water for 5 to 7 minutes. Allow it to cool down, and please, do not add sugar. If you need it sweeter, a tiny amount of raw honey is fine. Now, I have to insert a highly important medical caution right here. If you are currently on blood pressure medications, you absolutely must talk to your doctor before adding this to your routine. It acts as a potent natural ACE inhibitor, and it genuinely works, which means your medication dosing might actually need adjusting.
To really maximize this effect, here is the ultimate synergy tip. Pair your hibiscus water with a small piece of dark chocolate. We're talking 85% cacao or higher. The flavonols in the dark chocolate combine with the anthocyanins in the hibiscus to act synergistically. Together, they enhance your body's nitric oxide production far, far beyond what either of these compounds could possibly do on their own.
And here we are, coming in at the highly anticipated number 1 spot, beetroot water, the ultimate vascular tonic. Harvard-affiliated researchers actually linked beetroot extract to a staggering 38% reduction in arterial stiffness in adults over 70.
To understand why this takes the number 1 spot, we absolutely have to look at the science of nitric oxide. Beetroot is completely packed with natural nitrates. When you consume them, the beneficial bacteria on your tongue convert those nitrates into nitrites, which your blood then miraculously converts into nitric oxide. Think of nitric oxide as WD-40 for your arteries. It is the critical molecule that relaxes and widens your blood vessels so that blood and oxygen just flow freely. It fights fatigue and lets your heart pump with significantly less effort.
Now, what's really interesting about this slide is the sheer drop. Between the ages of 40 and 70, your body experiences a devastating 50% drop in natural nitric oxide production. Literally half of this critical molecule is just gone. And that is exactly why blood pressure rises and our physical stamina drops as we get older. Beetroot water doesn't just supplement your diet, it replaces a critical molecule your aging body has genuinely lost.
Here is exactly how to harness it. You can juice 2 raw beets, or let's be real, much easier for most of us, just stir 1 to 2 teaspoons of high-quality beetroot powder into 8 ounces of water. You'll want to drink it roughly 90 minutes before your most active period of the day to let that incredible conversion process happen. The synergy tip here?
Consume it with a source of vitamin C to stabilize that nitric oxide so it lasts much longer in your bloodstream. Oh, and a quick, playful warning for you, it might turn your urine a reddish color. It's called bichuria. Seriously, do not panic. It's just the pigment. You're perfectly fine.
So I've got a question for you. Which of these 5 drinks are you going to try first tomorrow morning? Are we talking coconut water, tart cherry, green tea, hibiscus, or the beetroot? Look, remember, these aren't miracle cures, but they are powerful science-backed allies that speak the exact language your aging vascular system understands. They are tools to help you reclaim your energy and your independence, so you can stop feeling like a passenger in your own life and start feeling like the driver again. Your independence, mobility, and energy are waiting for you on the other side of better choices. So, I leave you with this final thought. Which one will you start tomorrow to take back control of your vascular health? Drop your answer in the comments below, and as always, keep actively learning,